We do good work together. This is ThinkTech. This is Hawaii, the state of health. And that is Maile Sakamoto. She's the performance improvement manager.
Hello, hello.
And yeah, welcome to the show.
Again, thank you.
Again, yeah. We need you every now and then. We have to check in with you. So we're going to talk today about the State Department of Health and the performance improvement concept over there. Mm-hmm. And we call it QI at the DOH. QI standing for quality improvement, and the DOH, I'm going to let you figure that out by yourself. Okay, and if you want to, as a way of housekeeping, if you want to leave us comments or questions, Maile is really good at answering questions, even tough questions. You can do that on Twitter. And of course, that's ThinkTech HI. ThinkTech HI. We do get comments and questions, and we always answer them, and we always thank you for asking them. Okay. So, Maile, why do they need a quality improvement person at the DOH anyway?
Well, I can go back a little bit. So, this is actually was a grant from the CDC that was looking at infrastructure improvement. Centers for Disease Control and Prevention, which is the federal.
In Atlanta, Georgia.
Yeah, the federal health.
Some people think that God lives there. Never mind.
But
we know He lives here. She.
So, at any rate, they came up with this grant that was to look at infrastructure improvement for for the departments of health, because a lot of them need it. And certainly, our department is gigantic, if you've heard us talk about it.
I told you before that I was in the Coast Guard. The Coast Guard had something around 3,200 officers nationwide, worldwide, and I always measure things by that. And come to find that the Department of Health has more,
that many.
way more than 3,200.
Well, we actually have about 3,000.
3,000, okay. Same ballpark.
Yeah.
Okay.
And that's over 6 islands. It's, we have these many programs that other departments of health don't have. Like if you were to go to most of the departments of health on the mainland, it would just be the common public health services. But we've got mental health, we've got environmental health. We don't have local health departments. We do have offices on Kauai and Maui and the Big Island, but they are part of the State Department of Health. So it's all just this, massive
let's talk about that. You mean in other places you'd have a Department of Health that was a separate Department of Health for each county, for example?
There frequently are departments, yes. In a lot of states, they have their county health departments, and then the state health department would sort of, have funding that would go out to the counties,
but
and so they're smaller
the real
entities.
work, the on-the-ground work would be at the county level. Huh?
Yeah, sometimes. And we don't do a lot of direct services ourselves. I mean, in behavioral health, there are some, but, we're supporting a lot of the community health centers. We're, supporting a lot of other programs. So it's a very kind of different situation than a lot of other health departments.
It's got a huge schematic of all the offices and functions, whatnot.
And we're just so spread out over, can't remember how many different locations we had at the last count. It's like 70 or something, because also a lot of places have, like Nebraska or something. Maybe you can have a big, huge health department, everybody can be in it, but we don't have that kind of land space.
So, but let me ask you, does it have to be that big? It's big. It's big and it's complex and it has a lot of functionality. And you and I talked about the last time when we were together, the history of it. Back when in the 19th century, as a separate island state, monarchy, what have you. The idea was that the government had to take care of health. There were a lot of health risks, especially if you have ships coming in and out. You become a center for vectors of one kind or another.
And we still are.
And we still are. And so we really had to take care of ourselves. It wasn't like Arkansas. We had to take care of ourselves because things could happen here that wouldn't happen on the mainland.
Yeah.
And so the Department of Health conceptually became big and powerful, really, within state government. And thank goodness, knock wood, it never has had a really major challenge. Am I right?
Yeah, there have been some scares, but in part, that's because we've done our job right.
Yeah, okay, well, okay,
Yeah.
I guess so.
So, with all the surveillance and making sure that there's not disease outbreaks, so that they capture that quickly.
I'm sure I told you about my first case when I started practicing law. Well, we represented the Maui Quarantine Fund, which was a fund created by the merchants on Front Street in Lahaina. And they put money into the Maui Quarantine Fund because they were concerned that rats would come off the ships there. Now, this is in the 1880s, 1890s, or maybe around 1900, the year 1900. And the rats would have bubonic plague. And they would bite somebody, and before you know it, there would be an epidemic of bubonic plague in Maui, and the merchants wanted to have some kind of way to deal with that. I guess this is before the Department of Health was as big and, all-consuming as it is now. And so they put the grand sum of $10,000, there's a lot of money in those days, to, prevent against bubonic plague, and they called it the Maui Quarantine Fund. So I came here in 1965. The fund was at least 65 years old.
See, we've done our job well.
And the problem was there had been no bubonic plague at all, not even another rat kind of epidemic, nothing. And the money that was invested in, say, 1900 had grown because it had been invested, and it was, I guess, some good investments. And now it's with hundreds of thousands of dollars. What do you do with it? Because it's not likely we're going to have bubonic plague again.
No, but we could have something else.
That's the point. So we went to court on an application for CPRE in the equity part of the courts. CPRE in French means nearby. And the idea is that if a trust isn't able to do anything because its original language was too narrow, then you can reform the trust and expand or change the stated purpose of the trust in order to do what the original settlors really must have wanted to do. And so we told the court that they really must have wanted to cover more than bubonic plague, and the Maui Quarantine Fund should therefore be expanded in its purpose to go beyond rats and bubonic plague. And the court agreed, and then they got to spend some of the money.
So is it still there?
I don't know. Start doing the math. That was 50 years ago.
Well, it's been collecting all that interest.
Yeah. But it reflects, though, the state of mind of people in the business community and the legal community and the health community, that we, as an isolated place, we have to make special efforts. And you and I talked about how that changes the way we deal with an entity such as the Department of Health.
Yeah, and like I say, that is good. I mean, it shows that a lot of things haven't come in because we're getting, transportation being like it is now, we get a lot of things that can come in and they can take over if we let them. And so,
but
we really
we haven't done a lot of the things we'd hoped to do. I mean, for example, it was somewhat controversial. We haven't done the regional biosafety laboratory. Now, when Ed Cadman opened the medical school, or conceived of and built the medical school in Kaka'ako, one of his various dreams was to have world-class researchers in tropical medicine, infectious disease, tropical medicine. And he found a guy who worked for the National Institutes of Health, who was a world-famous researcher on tropical diseases.
Dwayne Gubler?
Dwayne Gubler was his name. And he built out, that is, Cadman built out a fabulous laboratory for him here. It went beyond any other laboratory at the medical school, the research building there. And he prepared, he prepared with unctions and oils, he prepared that this should be a huge and wonderful place for research in tropical diseases. But Gubler ran into trouble because he wanted to establish within that laboratory a regional biosafety lab. And biosafety is kind of a euphemism. It means we work with dangerous antigens here, and we do research that will be able to identify and maybe deal with dangerous antigens in case we are struck with that vector. And he had raised some $50 million through the state and the National Institutes of Health that he was going to put into this. And the first location, do you mind if I tell you the story?
Go
The
ahead.
first location that they tried was at the Waimanu home, which was a state Department of Health property up the end of the
Yeah, where the state laboratory is.
well, yeah, and, right, and it was up at the end of the Waimanu Home Road, okay, in Waimanu, coming off the Cam Highway, right, all the way up. And and it had been, you know, the jokes notwithstanding about the people who lived in the Waimanu home, you know, they were not, they had disabilities,
Yeah, it
mental
was a mental health
disabilities.
facility, yeah.
That stopped at some point, and they weren't using it for anything that I know of. And Gubler wanted to build this laboratory up there. But the problem is, and this is a problem that is ubiquitous all over the state of Hawaii, that in the intervening years between the time they originally built the Waimanu home for people with mental handicaps and the time the regional biosafety lab issue came up, developers had built the houses all the way up the hill, right to the fence of the Waimanu home property. So when they heard there was going to be an infectious disease laboratory of dangerous antigens up there, they squawked. They didn't want that just across the fence from them. And of course, that kind of community pressure, has great effect in a way. And so, no laboratory there.
Well, actually, the state labs, the big state labs building is up there. And in
But
the end of
not-
this
not-
month,
yeah.
Dr. Whalen, who's the lab director, will be on this show.
Oh, good.
And he will
We have
talk
to
to you
ask him
that.
about this,
Yeah,
yes.
well, and I think there are a lot of public concerns about the state lab being up there too, but to their credit, they went out and they did a lot of public outreach.
You got to do that.
You have to do that. You have to do that because otherwise people just are fearful of what might happen. And
Sure.
so you have to let them know, what kinds of things are in place, how you will deal with this. You have to get their confidence.
Well, and you have to
And
show
so-
them there's a reason for it.
Yeah, but you really have to take that time to deal with the public and not just think because in your mind that this is a wonderful thing that we're going to go ahead and do this and leave the public out of it.
Yeah, and Hawaii is a special place because it's an island place and we all have to live close by together, more and more going forward.
Yeah.
And so we have to be transparent or the other guy across the street, across the fence is going to be unhappy.
Well, and you really do have to listen a lot to what the concerns are, even though that you might say, well, that's ridiculous, you have to, address the concerns and with respect because.
Well, it sounded like Dr. Whalen
He's
did
done an
that.
excellent job.
Yeah.
Excellent job. They really.
But
yeah.
rolling it back, before the state laboratory was there, and this is 10 years ago, probably. I don't know how long the current state laboratory
I
is
think
there.
it's been.
More? Less?
He'll tell you about it.
Whatever. Dwayne Gubler was unable to assuage the concerns. And the tech community, the research community, the UH community was unable to assuage the concerns. And they went to venue number 2, which was in Kaka'ako, right next to the medical school, next to the research building, to build the regional biosafety lab. And I forget the exact denominations of a biosafety lab, but you go from 1 to 2 to 3 to 4, and as I recall, the higher the number gets, I think, the more protection you have. And the last one, which is, with dangerous antigens, it's like vacuum sealed. You have to walk through the vacuum packed door and it sucks all the air out of a chamber. And then you go to the next one and you have to wear a white outfit and all this. And it's, it's got to be secure. And so they wanted to build it in Kaka'ako, but people didn't like that there either.
It's in a tsunami.
Exactly.
Yeah.
Exactly. So you have some kind of dangerous, antigen in a refrigerator in the lab, and the lab is close to sea level, and the water comes up in a tsunami, and it just demolishes the refrigerator, and now you have the antigen floating up, into the community. So people were worried about that. They also worried. This is very interesting. About the transportation of the antigens, that you need to have these to do research on them. The transportation of the antigens from the mainland or wherever. And I'll never forget, I went to a hearing, a public meeting one time, and they were talking about what kind of igloo containers you would use and what kind of foam packing would be inside, and who watched it, who held it, who secured it as you took it on the plane. And was it going to be in the cabin of the plane or in the cargo department of the plane, compartment of the plane? Anyway, bottom line is a lot of people had a lot of concern about how you handle this.
Well, and
Yeah,
I think
there
a
you
lot of
go.
those are valid concerns, actually.
Yeah.
You want to know that people aren't just
In
like.
the end, the end of this little short story is that Gubler was a fantastic researcher, world class, and he could have dealt with infectious diseases that would have been scary. He could have identified them and found cures or ways to care for patients who had them. And the university, namely David McLean, felt that the opposition of the community had not been dealt with and decided he was going to pull it. And so he called the NIH one day and said, I'm not doing this. He didn't tell Dwayne Gubler about it. He just pulled a $50 million project. And Dwayne Gubler was not particularly happy about that. And he took a job with Duke University in Singapore. We didn't see much of him after that. So the result is we do not have a regional biosafety laboratory at any level of security here right now. And if we want to, check out antigens and see what they are and how you treat them, according to my knowledge anyway, we have to go to California or somewhere else.
Yeah, I know that some things need to be sent to Atlanta, but remember all of these questions, and when Dr. Whalen is on, then
Okay.
he'll be able to answer
I
them.
think that's
because he's
Miley's
got-
way of saying we should take a break now. We'll take a short break. Maile Sakamoto and me will be right back.
Aloha, my name is PJ and I'm the host of Hawaii Sports Update. I am very interested in local sports, and that's why I host the Hawaii Sports Update show. I bring in guests from Hawaii, I bring in guests from UH, I bring in guests from the community, I bring in big names, I bring in small names, I bring in all names that are community related and doing positive things, sports related in the community. Come join me every Tuesday at 1 p.m. here on Hawaii Sports Update. You can also join me on my golf tournament, the first annual PJ Sports Radio Show golf tournament. It's going to be held at Coral Creek. For any information, go to ThinkTech Hawaii, INC, and friend us. The PayPal and a summary of the event will be right there available for you. And don't forget to tweet us.
Okay, we're back. We're live with Maile Sakamoto, and she is the Performance Improvement Manager of the State Department of Health. But you work on a grant, right?
Yeah, it's an office of one.
And the grants only last for
It's a
so
program
long.
of one.
Yeah,
Yeah.
so what's going to happen?
Well, then who knows? But hopefully some of this that's been started will start to, percolate, infiltrate more into the department of the way of that you can change things, and it's for the better a lot of times.
Sure,
So-
well, at least
so-
somebody's watching, and that's
Yeah.
a good thing.
Yeah.
So what kinds of things, here you are, and what could be the sunset of the grant? Sorry to
It
put
is.
it that way. What are the things that you have been attending to, and what things have changed in your observation, and what things need to be changed in your observation?
Well, one of the things that we've been kind of waving around a lot because it's been pretty successful is that my grant-funded project called the Contract Genie, which actually somebody came in and talked about that, which was when they looked at how long it was taking the process to get these contracts through, it was just ridiculous. And you have the vendor on the other end of it waiting so that they can get the money so that they can do this process. But they're waiting. Sometimes by the time it goes through all this bureaucratic mess, that it's too late for them. They're
Everybody get disinterested already. They got other things to do, yeah.
So with my funding and with the help of the deputy director, Keith Yamamoto, and
He's my neighbor.
yeah, is he?
He's a great guy.
Yeah.
Hey, Keith.
Yeah.
Hey, Keith.
And this
We care about you, Keith.
a really great woman, Amy, who was on this show, Morton Soki. They put together something called the Contract Genie, which is a software program that would just eliminate a lot of the steps that were duplication types of steps. And they kind of looked at it from a very linear process of, well, you know, why does this person have to see this document again? And why did it come back 15 times and it turns out, you know, that the page number was wrong or something? So they, especially...
We've all heard stories like this.
For the neighbor islands too, you know, that's a lot of going back and forth, and just the time was really a lot of time wasted. And so they put together this software program that they've now, they're using it in behavioral health now, and it's just cut down the time for processing a contract dramatically. And so, you know, that was one of those things that get together and you just sort of look at these steps and say, you know, really, nobody has really looked at this before, but why does it have to take that long? And then you can say, well, you know, go through it. Maybe we can change something.
Yeah.
You know, and a lot of times people just say, oh, you know, that's government. It's been like that always. Well,
That's not acceptable.
Doesn't have to be like that always.
Yeah.
You know, especially with technology now, you know, there's really no reason that a lot of these things have to, you know, be done with a pencil and go.
With a quill pen.
Yeah, and go back and forth through snail mail and stuff like that. You know,
Yeah,
certainly there's things that can be improved, and so it's a time to sort of look at some of our processes. We're doing that now. Again, Amy's taking the lead on, Keith and Amy are taking the lead on looking at the process to hire somebody, because so many of our programs were short-staffed. But this process to hire somebody, I think they did a flow chart, and it was like 9 or 11 pages or something like that of just all these steps. So they're going through that now to see, you know, can some of this be eliminated? You know,
Yeah.
and so it's great because they are finding that, yes, some of that can, you can do this
So
differently.
let's talk about the process of looking at the process. So here you are. You're the performance improvement manager. And you suspect that the process of hiring somebody for the Department of Health may be a little overblown. So what do? You go and you talk to the supervisors, you go to talk to the people who are responsible, and you say, tell me exactly what you do. Is that what happens?
No, actually it starts with who would like to see a change made and who will take the lead on it. And in this case, it was Keith. So being the deputy director, he has a lot of clout. And so...
I hope so.
Yeah. So we can say, okay, you know, so Maile, do you have any, you know, do you have funding from your grant to help put this together? And with the contract genie, it was, you know, yeah. So we'll put some money over that way. He has Amy working there, and Keith took the lead on both of these because he's a very process-oriented person. And so... and he also has the ability to pull the people together and say, you must come to this meeting.
He's very affable, and he understands how Hawaii works.
And yeah, and then it takes time. You know, you need to involve a lot of people. And get feedback on these processes, and so, but you do need to kind of, you know, here's the end point. We need to fix this, but then as you go back up the channel, like what are the different things? Where is the problem that really needs to be fixed?
So who is doing this? Are you doing this, or somebody who's working for you or him? I mean,
Nobody
where do you
works
find the
for me.
staffers that are actually going to make this schematic?
Well, there's like for say the contract genie, a lot of the programs have people that process their contracts, and so those would be the people that would be involved with this because they're the end user essentially. You know, what would make their job easier for this? And so it's like, and for the hiring process, it's the people in the HR department, people in the fiscal department to see that there's money there. And so involving the people that deal with this so they can tell you like what in this process does not
So you ask their
work for
advice.
them. Oh, absolutely, and also the people that are trying to hire in the different programs. You know, where are you finding the problems? What do you keep running into? And then when you take all this information, then, you know, you can kind of see where there might be areas that really need to be addressed.
So do you find resistance when you make an inquiry like this? Because some people, You know, maybe they like to do it the old way, and they like to do molasses because molasses makes it easy life, kind of thing.
Well, it's, the state is an old department, and the way that their things work have been, since
Since 1900.
Yeah, so there's some people that are very reluctant to try something new, especially, the technology can be a little intimidating sometimes because it's so quickly changing, and it really does, you have to think in different ways sometimes. And so
I remember in the judiciary, up to a certain point, there were
file
no
cards.
computers at all, or none, and
Yeah.
it was written down in these filing cabinets, and
the
if you
file
were one
cards.
of the lead clerks, you knew by recollection
Mm-hmm.
where things were. And that made you a very powerful person,
Yeah.
by the way, and a person who would resist change, by
Sure,
the way.
sure.
And one day the computers came to the judiciary, and a lot of people did not
Did
want
not
to do
want it,
anything
yeah.
like that. And I remember when automated medical records, what do you call it? Electronic medical, EMR.
Yeah, something.
A lot of doctors, staff,
Oh, yeah,
they didn't want
yeah,
any part
yeah.
of that.
Mm. Yeah, my
And
friend
this
was
is gonna
working on the IT for that.
undermine my ability
Yeah.
to take care of my patient. That's
Yeah.
what they would say.
Yeah, she had a lot of kickback on that. But part of the other piece of looking at sort of performance improvement and quality improvement in the long run is really looking at that long-term vision. And, people that have been, who are 300 years old, who have been in a position there forever, that
I know some of them.
it's like, okay, well, we're very grateful for what you've done, but how do we also encourage younger folks to come into the department who have who have grown up learning these kinds of things and who can take a cell phone and figure everything out on it immediately. So it's like, yes, people have the historical knowledge, and that's important. But you also want to look at the future of the department and make sure that we're, pulling in people that can sort of roll with what comes up in
Yeah.
the future. So.
You want to institutionalize that knowledge, but also clarify it, and also bring in the technology.
Yeah, and things change so
You have
rapidly.
to do this every so often. It's not just once, right?
Well, yeah, that's why I think that as people sort of get used to this, it's called continuous quality improvement, CQI, that it doesn't become like such a big, huge thing. It doesn't become such a fearful thing. It's just something that you do, kind of. If you see it, something that's not working, why isn't it working? And let's take a look at
Let's
this.
fix it, yeah. Why does this remind me of the highways? Why, for example, so somebody complains there's a pothole, so we galvanize this whole mechanism to go fix the pothole. And it's a public spectacular. There'll be something in the newspaper about the pothole, and people will be outraged, and there'll be a whole public discussion about the potholes. Why don't we just do it as a matter of course, always? Same thing here.
Yeah.
Just fix it.
Yeah. But there is, the also issue of getting the right people together who can make these decisions. And sometimes, what I've found with the department is that it's so siloed that sometimes staff doesn't have the opportunity to work across those silos. We don't provide them those opportunities. And so, this branch could be doing something that this branch also has an issue with, but they don't know that because they're never able to talk to each other. So it's like, how do we facilitate sort of the staff being able to communicate across?
Part of it is to have you, really. Because, that's part of your grant, your job, isn't it?
Yeah,
To
it
look
is.
at these things.
Yeah, it is, and they are like trying different things. There's I want to give her credit for this, but the chief of the public health nurses is a fantastic person, and she does something. She works on her own out in this Taro Lo'i and Wailua, and she invites DOH staff to come out there. And so when you're working together out there in the mud, it's a great place to communicate. You're all just sort of equal. And it's providing those kinds of opportunities that are not the traditional, you sit in a meeting room and you have, 2 hours and everybody, and then you walk away. It doesn't sort of grab you, like some of these other communication things would do.
You're talking about more than just figuring out a way to make hiring faster. You're talking about a way to improve institutional thinking
Yes.
and to get the whole organism working together on the same page with the notion of efficiency.
Yeah, and the staff knows this. You know, they know that there's things that really need to be changed, and
So you're really sort of drawing them into a process of change.
yeah, and or making those opportunities available, I think.
Yeah.
And I think that's
Well, you know, I don't think that either of us mean to imply the State Department of Health is any worse than any other agency in the state, or for that matter,
or
any
the
federal agency.
federal agencies. Yeah.
Because they have, federal agencies in my lifetime have taken this whole problem to a new level.
Yeah.
Uh,
Yes.
A new and remarkable
Yes.
level. And a level that did not exist when I got out of law school, you know. But let's take a break
Okay.
and let that settle in. And we'll come back and talk some more about what has been done, can be done, and should be done to make it all more effective, more efficient.
Okay.
How exciting. We'll be right back.
Hi, I'm Chris Leatham, and I'd like to invite you to come and watch my show every Wednesday at 3. I'm interested in a variety of issues that have to do with politics and our local business economy. And I'd like to bring on guests who like to talk about everything from technology to social media to what we can be doing to improve our environment. And so I'd like to invite you every Wednesday at 3 to stay and watch my show here with ThinkTech Hawaii. And I'll see you there.
Aloha, my name is Josh Green. I'm a senator from the Big Island in the ER position. Every other Tuesday, I get to host a show here on the ThinkTech program about healthcare. We call it Healthcare in Hawaii. It's really enjoyable for me to bring other healthcare leaders from around the state to talk about our pressing issues. Hawaii has long been the health state, but we need to keep up the momentum, the inertia, and with your help and with your participation, we can come and share all of the big issues that are pressing day to day. Thanks for joining us every Tuesday, alternating weeks from 2 to 2:45.
Okay, we're back. We're live. We're here with Maile Sakamoto, which is great. You know, this is quality time, Maile. Thank you for coming down and
You're welcome.
presenting yourself for this discussion. So, you know, where are we? I mean, this sounds like what's happened, you know, in the management of performance improvement is a good thing. And it would be a good thing in any agency. I don't know if you or I could say that this is happening in other agencies.
It is.
It is? Okay. In the state. It's a good sound. That's a good thing.
Yeah, it is. And you were talking about highways, but DOT is doing some really interesting things. And so I think that, you know, Hawaii is kind of at that place now where people feel like we want something to change. And so how can we do that?
Is it fast enough? You know, to me, I see through, and this is going to hard to believe, but I see things through the eyes of the millennials. I make myself into a millennial. In my heart, I am a millennial. Okay.
Good.
And I'm looking at state government. I'm saying, oh, God in Himmel, this is a real problem, and we have to get it working better, faster.
Yeah.
Not only because I may want a job there, which is actually they don't want jobs in government. I don't think they do. But you know, so that it serves people, and nobody says it's inefficient, and it's not going to cost too much money, and all that. So the question is it happening fast enough?
I don't know, but you know, I think we can't just say, well, it's not happening fast enough or whatever and get paralyzed by that.
That's true.
I think we just need to start moving. And for us at least, Department of Health, people don't come into public health because they're going to make $1 million. You know, we draw a different kind of person in there. They really do want to try and make a difference. They want to help their people. They want to, you know, protect the environment. They want to do things like that. So if we can make, you know, the department be functional where they can get that kind of, you know, they can move on their passion and they can get things done, then I think that that's a job that we need to do.
Yeah, you know, that is such an interesting thought. You know, I referred to the Coast Guard earlier. That was the difference about the Coast Guard too. The Coast Guard, you know, whatever reason, it has an image of trying to save lives. and not go to war, not shoot anybody up, just to save lives. And most of the people in the Coast Guard have signed up, it's volunteer, it's all volunteer, have signed up or gone to school, gone to the academy to do exactly that. And they are at a very humanistic level, at a very idealistic level. And what better way to spend your life? You know, do you need to be rich? Is that going to make you satisfy you and satisfy your intellectual and emotional needs on the planet? It sounds like the people in the Department of Health are along the same lines.
Yeah, we've got some really, really incredible staff, and actually, thanks to this program, and you know, I've been able to meet a lot of them. I've coordinated them to come on this show, and I've really enjoyed meeting so many of them, finding out what the department does, because you know, really, there's some great, great people there. And so for me, I feel like it's my job to be able to enable them to do their work, and whatever processes they need, what kind of help they feel they need, then you know, to try and do that, because they are remarkable people and they are really trying to, and it is difficult with this bureaucracy, this not just Department of Health, but you know, the bigger state bureaucracies and things to get things to move, where you can you know, get your purchase orders, to get your hiring done, get you know, the staff. So it's
What about Neil Abercrombie's, he had a great plan, and he brought in Sonny Bagwalia, and he made an information, and he actually had a public-private partnership going. He got some money from Piero Midyar and Ulu Ponu. I think he also got some money from Hank Rogers and Blue Planet, and they developed a sort of a report on how old the computer system was and how it was dysfunctional all over state government, and what it would need to get current and get better and integrate all the functions and departments and whatnot. God, it reminds me of that old issue years ago. I think it was during the Caetano administration. How many people actually work for the state of Hawaii?
yeah,
And
it's
then
huge.
nobody could answer it, you know? It was
huge,
really
yeah.
amazing. But there was a very important thing for him, but it didn't happen. I don't think we're there or even specifically going there right now. And it was going to be expensive no matter what, but before you spend the money, you still have to have a plan. You have to have people in all aspects of government willing to execute the plan. So how about the Department of Health? How did that plan affect the Department of Health? How do computers affect the Department of Health? And what about computers that are connected, you know, all through the state government, which hasn't happened yet?
Yeah, well, our IT guy would actually have to answer a lot of that to tell you about how department
I never promised you a rose garden.
is connected. We are looking at some programs using like computers for telehealth that are very exciting. They've done this in New Mexico actually, which is similar to Hawaii in that they have, you know, a couple of large urban areas, but then they have a lot of very remote rural areas. And so how can they get assistance out to those rural areas? So this is called Project Echo. It's really taken off in quite a lot of
New
places.
Mexico.
Yeah, well, and it's taken off in a lot of areas. So a group from Hawaii went over to New Mexico and was trained about this. And so they're looking to pilot a project pretty soon to see how we can start to use that to, you know, expand our services, essentially. Because there's some places that are pretty remote that just, you know, it's difficult to get.
Well, you know, especially the neighbor islands, we should connect them all up with the internet. We should connect them up with, you know, with practical nurses and with doctors.
Absolutely, and actually
and
there's
even
some
experts. I mean, specialist doctors.
Yeah, there's another project going on in Pahala on the Big Island, because, you know, that whole area, the Big Island, it's so remote, and it's a long drive to get to Hilo. You know, so how can we empower some of the people who live in these communities to get some of these skills, and then they can be the providers.
That's what broadband is all about.
Yeah.
And this is so central in our lives. You know, I mean, it's nice to go shopping at Amazon, you know, on the computer, but wouldn't it be better to save your life? Wouldn't it be better to find out what ails you and get some good medical advice?
Well, and also just, you know, for public health, we're always looking at prevention. So what are things that you can do to stay healthy, to, you know, keep from having some of these things that come on.
This is
that
the
are-
true heart of Hawaii, to care about people and care about the population and let everybody, be healthy.
And I think that that's where, we've gotten a little bit off track with that, but I think it's, coming back to that, the true heart of Hawaii. What are some of the, real values, Hawaiian values that people have? And I
Yeah.
think that the public clicks into that. What they don't click into is when you just show up and say, we're going to do this, and
Yeah.
too bad
Well,
about
we
you.
had a
So-
lot of projects that didn't work out so well. I mean, I guess about 10 years ago, HMSA started a telehealth program, and we actually interviewed the guy. He was from some very good schools on the East Coast. He was an Israeli, as I remember, and he came up with this whole big system. And you knew there was a problem because not a lot of doctors agreed to do it. Okay, so you wound up not talking to your own doctor, but to some other guy, and that you realized that this was not exactly what had been intended. Anyway, it didn't last that long. I think part of it was the medical establishment didn't really want to do it. They wanted to have their office visits. There was an issue about reimbursement for medical services rendered over the computer, and I'm disappointed that the Affordable Medical Care Act doesn't stress this kind of thing more. I think that the insurance companies, plus the large medical institutions, plus the state's Department of Health everywhere, can and should do this. They should follow me. I don't mind. They can have my medical information. I'm not wild and crazy about secrecy. I just want to be able to pick up the phone and talk to a medical professional.
Yeah. Well, we're coming, public health is kind of, the concept of public health is a little bit different than the medical model. And so that's what, we're coming from sort of the preventative side again. So hopefully, but if you get to that point, you need to, but again, what I see is just getting more people out in the community that can kind of be the messengers for this. And then you have a broader support. I think, like you were talking about Bagwalia, it's like who else was involved in that? Who else knew what they were planning, what was going on, what kind of...
Not me, and I tried to know.
And so it's like you have to put that effort forward to involve more people and not just you go in there and tell them, but really talk to people. And I found that it's
People
really...
on all sides of the equation.
Yeah.
It's not just the public, the patient, it's also the medical community, people who render services to the patient. Yeah.
There's a lot of folks involved, and I think, it's really, you have to do that bit of homework.
Yeah.
It's crucial.
So how about you, now at the sunset, potentially, the sunset of your grant? I mean, I'd like to continue to deal with you. Then tell me what your plan is, what's going to happen now.
I don't know.
for
I
you.
can go and sit at the ceramic studio and
Who's that
do
woman
things
that's smiling?
I feel like there's, like I was saying, that we're really on sort of the cusp of making a lot of changes. There's our director is very interested in changing
She's great.
Some things. Rachel Wong, who's the director.
Rachel Wong
yeah,
is great, too.
she's great, and
Yeah.
Suzanne Case is great. So there's some really good people at the top now, and hopefully, we can kind of make something different happen, because I think the people are in place right now, and
Yeah.
so it's just
for change.
yeah, it's kind of exciting.
Certainly, Jenny Pressler can make things happen.
Yeah,
She's been
yeah.
around. She's seen it in so many different places, and she knows the department.
Well, and she sees it from the public health as well as the medical side, and so she, kind of understands.
yeah.
That's,
Well, but I get the feeling though that together, this cadre could find new process for reaching more efficient management of resources and knowledge, and that could be a model for other agencies to follow.
well, certainly, we can make better use of our resources if we knew where we can overlap with different areas within the department, instead of everybody kind of doing their own thing.
Yeah.
We could work together on that a lot better. And I think also it's really important to sort of go back to where we live, that this is really, this is Hawaii. We've kind of gotten away from that a little bit.
Yeah.
And I think come back to that. I think that will really resonate.
Okay, well, let me offer you 1 minute more. That we call that camera 2, but we have gotten used to calling it the David Ige camera
Why?
because we ask our guests to talk to him.
Oh.
So would you leave your message with him now? Governor Ige, it begins with Governor Ige, could you please consider the following? Go ahead.
Okay, Governor Ige, would you please consider the following of allowing the departments to work together and sort of look at the message of Live Aloha and how we can all kind of work in that direction to make sure that we're taking care of Hawaii and not just, well, I'm going to leave that part out.
We got it.
I'll stop there before.
Maile Sakamoto, stopping there. Performance Improvement Manager for a long time at, well, not that long.
Not that long, yeah.
At the
2
State
years.
Department of Health, here in Hawaii, the State of Health. Thank you so much, Maile. Aloha.
Aloha.